I want to start with a number that stopped me when I first read it. Millions of older Americans have prediabetes, blood sugar levels that are elevated above normal but not yet in the diabetes range, and the majority of them don't know it. No symptoms they can clearly identify, no obvious warning signs, just a slow, silent process happening in the background while life continues normally. And here's what makes that number genuinely significant. Prediabetes is not a fixed destination. It is a window, a period of time, often years, during which the direction of what happens next is still very much influenced by the choices you make. The National Institute on Aging's research is clear on this. There are specific, documented ways to help prevent or significantly delay the progression from prediabetes to type 2 diabetes. But most people in that window don't know they're in it. And many who have already crossed into type 2 diabetes are managing a condition they don't fully understand, including connections between diabetes and brain health that most doctors don't have enough time to explain clearly in a standard appointment. Today, we're drawing directly from the National Institute on Aging's guidance on diabetes in older adults. And I want to build towards something that I think will genuinely shift how you understand this disease, a specific connection between blood sugar control and cognitive function that makes managing diabetes not just a physical health priority, but a brain health priority. Stay with me, because that connection changes the stakes considerably. Let's start with what diabetes actually is, because the explanation most people received was incomplete, and the gaps in that explanation make the disease harder to manage than it needs to be. Glucose is your body's primary energy source. It comes from the food you eat and is also produced by your body. To use glucose as energy, your cells need insulin, a hormone produced by the pancreas that acts essentially as a key, unlocking cells so that glucose can enter and be used as fuel. In type 2 diabetes, which is the most common form in older adults and the form we'll focus on today, the cells stop responding to insulin properly. This is called insulin resistance. The body may still be producing insulin, but the cells aren't responding to it effectively. Glucose that should be entering cells and being used for energy stays in the bloodstream instead. And elevated blood glucose, sustained over time, begins to damage blood vessels and nerves throughout the body. Type 1 diabetes works differently. In that condition, the body produces little or no insulin at all, and insulin must be supplied externally every day. Type 1 most often begins in childhood or young adulthood. Type 2 is the form that most commonly develops in middle age and beyond, and it's the one most directly influenced by lifestyle factors. Prediabetes sits just below the diagnostic threshold for type 2 diabetes. Blood glucose is elevated, higher than it should be, but not yet high enough to technically qualify as diabetes. The NIA is explicit. People with prediabetes have a greater chance of developing type 2 diabetes, but the progression is not inevitable. Maintaining a healthy weight, exercising, having glucose checked regularly, and working with a doctor on medications or lifestyle changes can meaningfully reduce that risk. Let's talk about symptoms, because type 2 diabetes has a characteristic that makes it particularly difficult to catch early, one that catches people off guard and contributes to the disease being significantly underdiagnosed. Symptoms of type 2 diabetes often develop slowly, and they may go unnoticed for a long time. Some people with type 2 diabetes have no symptoms at all. They only discover the condition when other diabetes-related health problems emerge, by which point the disease has already been silently causing damage for years. When symptoms do appear, they can include feeling consistently tired, increased hunger or thirst even after eating or drinking, unexplained weight loss, urinating more frequently, numbness or tingling in the hands or feet, blurred vision, slow healing cuts or bruises, and recurring skin infections. Here's where most people get it wrong about these symptoms. They attribute them to aging. Tired, well, I'm getting older. Thirsty, I probably need to drink more. Slow healing, maybe that's just how things are now. And in doing so, they miss what may be early signals of a condition that is both serious and highly manageable when caught early. The NIA's guidance addresses this directly. Sometimes older adults dismiss symptoms of diabetes as just part of getting older. But these can be signs of a serious problem that deserves medical attention. If any of these patterns feel familiar, if you recognize them in yourself or someone you love, They deserve a conversation with a doctor, not an emergency, not alarm, but a conversation and a blood test. Let's talk about testing, because this is an area where clarity matters enormously, and where understanding the tests helps you participate more actively in your own healthcare. There are several blood tests used to diagnose diabetes. The fasting plasma glucose test measures blood sugar after at least 8 hours without eating. The A1C test is different. It measures your average blood glucose over the preceding 3 months, giving a much broader picture than a single measurement on a single day. You can eat before an A1C test, which makes it more accessible. And because it reflects months of glucose management rather than a snapshot, it's among the most informative diagnostic tools available. There is also the oral glucose tolerance test, which measures blood sugar before and then 2 hours after consuming a sugary drink, and the random plasma glucose test, which can be taken at any time without fasting. Your doctor will determine which tests are appropriate for your situation. What matters from your end is knowing that these tests exist, understanding what they measure, and taking the results seriously, including results that fall in the prediabetes range. A prediabetes result is not a diagnosis to be filed and forgotten. It is important information with a meaningful response available. Now we arrive at the section I've been building toward, and I want to tell you directly, this is the information that most people who have diabetes, or are at risk for it, have never been clearly given. This is why I want you to stay with me. It's about the relationship between diabetes and the brain. The National Institute on Aging's guidance states this clearly. Older adults with diabetes are at higher risk for depression and cognitive impairment compared to others their age who don't have diabetes. Let that land. Not just eyes, kidneys, heart, and feet, which are the organs most commonly discussed in diabetes care. The brain, thinking, memory, mood, the very cognitive capacities that allow you to manage your own health, make decisions, stay independent, maintain relationships, and do everything that makes life meaningful. This next detail changes everything about how you should think about blood sugar management. The brain runs primarily on glucose. We discuss this in our videos on Alzheimer's disease and brain aging. It consumes an extraordinary proportion of the body's total energy, and the brain's access to that energy depends on healthy blood vessels and efficient insulin signaling. When blood sugar is chronically elevated, when the small blood vessels that supply the brain are subjected to years of glucose-related damage, brain health is affected. Research suggests that poorly managed diabetes is associated with accelerated cognitive decline and increased dementia risk. The same vascular damage that affects the eyes and kidneys affects the brain's blood supply, and the depression connection is real and bidirectional. Diabetes increases depression risk, and depression makes diabetes management harder because it reduces motivation, disrupts sleep, affects appetite, and makes the consistent self-care that diabetes requires feel impossibly burdensome. This is why the NIA recommends that doctors screen people with diabetes for both depression and cognitive impairment. If you have diabetes and you have not been screened for either of these, that is a conversation worth initiating at your next appointment. Managing your blood sugar is not just about protecting your kidneys and your vision and your feet. Research suggests it is protecting your brain, your mood, your cognitive independence, everything that allows you to remain fully yourself. Now let's talk about management. Because if the picture I've painted sounds serious, it is. But it is also genuinely manageable, and the tools available are more within your control than most people realize. Many people with type 2 diabetes can manage their blood glucose levels with diet and exercise alone. That is not a minimized or oversimplified claim. It is a documented reality for a significant number of people with the condition. The disease responds to lifestyle in ways that many other chronic conditions do not, which means your daily choices carry real power. Food choices directly affect blood glucose, not just what you eat, but when and how much. Working with your healthcare team to understand the specific eating pattern that works for your body, your glucose levels, your weight, your other health conditions, is more effective than following generic dietary advice. Ask for a referral to a registered dietitian if you haven't had that conversation. A personalized food plan is one of the most powerful diabetes management tools available. Physical activity, specifically walking and other consistent daily movement, improves glucose levels in older adults with diabetes. This is specifically noted in the NIA's guidance. Movement improves insulin sensitivity, which means cells respond better to the insulin the body produces. The goal the NIA sets is being active most days of the week, not intensely, not for hours, but consistently, a goal that is genuinely achievable for most people. For many people, lifestyle changes alone are not sufficient. Medication is needed to manage blood glucose effectively. Some people also need medication for blood pressure and cholesterol, which diabetes elevates risk for. Taking prescribed medications consistently, understanding what each one does and what side effects to watch for, and communicating promptly with your doctor when something feels wrong. These are the active behaviors of someone managing their condition well. Let's spend time on the body systems that diabetes affects beyond blood sugar, because this is where the comprehensive nature of good diabetes management becomes clear. Eyes deserve annual examination. Diabetes can damage the blood vessels in the retina, the light-sensitive tissue at the back of the eye, in a condition called diabetic retinopathy. Caught early, many eye problems related to diabetes can be treated or slowed significantly. Missed because no exam was scheduled, they can progress to serious vision loss. Kidneys need yearly checking. Diabetes is one of the leading causes of kidney disease. Annual blood and urine tests can detect early kidney changes before they become serious, which is exactly when intervention is most effective. Feet require daily attention. Nerve damage from diabetes, called peripheral neuropathy, can reduce feeling in the feet, meaning injuries that would normally be noticed and addressed may go undetected until they become serious. Daily foot inspection, keeping feet clean and protected, wearing shoes and socks consistently, and seeing a podiatrist for any sores or skin problems are all part of active foot care that prevents avoidable complications. Dental health is connected to diabetes in ways many people don't know. Elevated blood sugar increases infection risk throughout the body, including in the mouth. Regular dental checkups, daily brushing and flossing, and prompt attention to any gum or tooth problems are part of managing diabetes comprehensively. The NIA also recommends staying current on flu shots every year and the pneumonia vaccine, because people with diabetes are at higher risk for serious complications from respiratory infections. These vaccines are not peripheral recommendations. They are part of diabetes care. Let's bring everything together with practical actions. The first is to know your numbers and take them seriously. If you haven't had an A1C test or fasting glucose test in the past year, ask for one at your next appointment. If your results fall in the prediabetes range, treat that as important information that warrants a real response, not reassurance and a return appointment in 12 months with nothing changed. This is a window. Use it. The second is to make daily movement non-negotiable. Walking most days of the week, at whatever pace and duration works for your current fitness level. This is the single most accessible, most consistently supported lifestyle intervention for blood sugar management. It doesn't require a gym membership. It requires a decision made consistently. The third is to build a complete diabetes care team and use it. Your primary care doctor, an endocrinologist if needed, a registered dietitian, a podiatrist for foot care, an ophthalmologist for annual eye exams. Diabetes management is a multi-specialist endeavor. No single appointment covers everything. Build the team deliberately. The fourth is to talk to your doctor specifically about brain health in the context of your diabetes. Ask whether you should be screened for depression. Ask whether cognitive function is something to monitor. Ask what blood pressure and cholesterol targets are appropriate for you, specifically given diabetes' effects on the brain's blood supply. These conversations add depth and completeness to your care that standard appointments may not cover automatically. And the fifth is to address cost barriers directly and immediately, not silently. Diabetes medication and supplies can be expensive. If cost is affecting whether you take medication as prescribed, tell your healthcare team. There are generic alternatives, assistance programs, and insurance coverage options that your team can help you navigate. The NIA specifically recommends asking for less expensive options or generics. Not taking medication as prescribed because of cost is a problem that can be addressed. but only if it's named. Here's what I want you to carry with you from today. Type 2 diabetes is a serious condition. The NIA's research is honest about that. The potential complications span the eyes, kidneys, nerves, feet, heart, and brain. The risks of poorly managed diabetes are real and significant. But so is the capacity to manage it well. The lifestyle factors that protect against diabetes and that slow its progression in people who already have it are genuinely within your influence. Movement, food choices, regular monitoring, a proactive relationship with a healthcare team that sees all of you, not just your blood sugar numbers. And now you know something that changes the stakes. Managing blood sugar is not just protecting your physical body. Research suggests it is protecting your ability to think clearly, to remember, to stay yourself, to maintain the cognitive independence that underlies everything else you value. That is not a small thing. That is one of the most important reasons to take this seriously. You have the information, and with it, you have real options. Before you go, here's something I want to plant in your mind for our next conversation. We've talked today about diabetes as a condition that affects blood sugar, blood vessels, and ultimately the brain. But there's a dietary pattern that research consistently connects to reduced diabetes risk, improved glucose management, and better brain outcomes simultaneously, and that most people have heard of but don't fully understand in terms of why it works at the biological level. It's the Mediterranean-style eating pattern, not as a trendy diet, but as a specific nutritional approach with documented effects on insulin sensitivity, inflammation, and cognitive aging. The mechanism is specific, the evidence is substantial, and the practical application is more flexible and accessible than most people assume. That's coming up next. And if you want to keep getting clear, research-grounded, genuinely useful guidance on aging well, subscribe to this channel. Take very good care of yourself. Your health is worth understanding deeply. And now you understand it a little better.